Excellent. Thank you. Good morning, everybody, and welcome to the Joint Boards of Health and Hospitals meeting for February. My name is Tim McBride, and I'm the interim chair of the board. And so without further ado, I'll call us to order. I think our first order of business is to approve the Zoom video from January 20th as the minutes. Do I have a motion for that effect?
Move approval of Zoom minutes.
Do I have a second?
Second.
Lisa, thank you. So the minutes from the January meeting are approved. Now I'm going to turn it over to our Dr. Maddie for her update. I think you said you don't have slides yet because you're having some.
Tim, we need to have an actual vote on the minutes.
Oh, we do. I'm sorry. Thank you. See, I don't know what I'm doing. So all in favor of approving those minutes, raise your hands.
Aye.
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 Anyone opposed? No one's opposed, so now they're approved. Thank you, Will. Okay, Dr. Maddie, I think you said you would start your report without slides.
Yes, I apologize this morning. I'm having technical issues in my office, and so I won't be able to share slides. I will make sure they're sent after the meeting. So to give you an update on where we are with COVID-19, so cases have been rapidly decreasing in the past few days. In the past few weeks, I beg your pardon. We were previously at a peak of 35% case positivity rate, which is now back down to just under 10% as of yesterday. This has been very reassuring because the rate of decrease has been such that it has been consistent. One thing we like to avoid is prematurely getting too comfortable and scaling back, but that has not been the case. So the 2-week case count average shows a 66 decrease in daily cases, and case rates have largely returned to pre-Omicron levels across the country. When we look at what's happening in the city of St. Louis, the 7-day case count average continues to drop and has fallen to 55 cases a day on average. And just to put that in context, the previous peak during the Omicron surge was 517 over a month ago. That's an 89% decrease. Around this time, you've seen these slides often enough to know we kind of look at mapping these cases by census tract and zip code. And we continue to see higher case counts in the South because that's where the darker density on those maps usually is. But when we adjust for population size, there's a relatively random distribution across the city with high case rates, census tracts in the North, Central, and the South. That's been pretty consistent. So testing usually is highly correlated to what's happening with cases. So the number of cases being performed each day peaked at more than 3,500 combined PCR and antigen tests. But over the last month, we're seeing daily tests drop down to fewer than 1,000. And this may also be impacted, though. We need to remember that we now have greater availability of at-home antigen tests, which usually go unreported to local public health departments. So I already told you what's happening with the PCR rate. We were at a peak of 35%, just under 10% now. And we're hoping that will fall and we can stably stay in under double digits. As far as COVID-19 by race, African Americans have been disproportionately affected by COVID throughout this pandemic. In the first 2 weeks of February, 60% of new cases identified as African American. When we start talking about age, in the first week of February, the proportion of cases aged greater than 60 has decreased. Outbreaks in long-term residential facilities has led to clusters in cases in the elderly. The highly infectious, this Omicron variant may be evading immunity in the older age group, and booster doses continue to be critically important, especially to protect our seniors. So when we look at vaccinations in the pediatric population, as of February 4th, 46.6% of eligible school-age children have received at least one dose, 37.7% completing their series. But this disparity in Black communities continues to be very concerning. So children living in predominantly African-American zip codes have much lower vaccination rates. 29.4% receiving at least one dose compared to 69.1% in the Caucasian zip codes. And, this continues to be of concern. We know that unvaccinated children are likely to suffer more likely to suffer from secondary causes of COVID exposure. And we don't yet know what impact this may have on long-term development. I told you that we had partnered with Dr. Alvin Gang in looking at the Lima model, which can predict the number of hospitalizations from COVID based on how many have been observed and other underlying assumptions. And I'm pleased to report that those projections continue to show that the decreases that we're currently experiencing will persist. When we look at new hospitalizations and current and those currently hospitalized, this is also reassuring. In recent weeks, the number of new hospitalizations has been sharply decreasing, and the number of patients currently admitted has been more than halved. So we're no longer at critically high levels. So let's talk a little bit about vaccination rates. 60.9% of people age 5 and above in the city of St. Louis are fully vaccinated. This is an absolute triumph, but the concerning part is those individuals that were boosted. Only 24.7% of people above the age of 12 are boosted, and this needs to be a focus of moving forward, obviously through a lens of equity. We continue to hold small neighborhood clinics to bring the vaccine to where people live. I think the shift is less on large one-time events and really trying to use trusted messengers in partnership to go to communities and be able to reach them where they are, be able to have dialogue and provide vaccines in that way. And so we have done so with school districts successfully, FQHCs, our clergy advisory board partners, and a total of 602 vaccines were distributed by partners so far in February. So one thing I think that is worth noting before I wrap this up and open it up to questions and dialogue is, the CDC recently reported out that unvaccinated adults are 17 times more likely to be hospitalized than fully vaccinated adults. And compared to fully vaccinated seniors who received a booster dose, unvaccinated seniors are 51 times more likely to be hospitalized. Locally, roughly 60% of hospitalized individuals are unvaccinated. This data highlights just how effective vaccines are, how important we need to continue with our vaccine efforts. But one of the mistakes that we made throughout this pandemic was to lean into one mitigation strategy at any given time and not understand that this has to and always will be a multi-layered approach to the pandemic. It's obvious that people have pandemic fatigue. It's very, we start to hear words like endemicity thrown around. And that's dangerous, quite frankly, because endemicity from a scientific and public health perspective has very clear criteria. And we have to let those be the lead rather than where we may be politically and where we may be from a point of pandemic fatigue. So one of the biggest questions that are obviously looming is what the city is going to do in relation to our mask mandate. And I want to address that very clearly. We have, and we will continue to have a data-driven approach to when to ease on mitigation strategy. The numbers that we have are very reassuring. If we stay where we are stably for the next 2 to 4 weeks, I believe that a conversation about mask mandates must be critical. But it is not a conversation about removing mask mandates and moving forward. There are still at-risk populations that, regardless of where we are with COVID and whether or not we're in our new normal, will continue to be at risk. And we cannot leave them behind just because we are, for lack of a better phrase, over it. So that conversation will also include how to be responsible about meeting the needs of the most at risk, our elderly, our immunocompromised, and certainly African American and other minoritized groups that have been disproportionately impacted. So I will stop there and take any questions or comments.
Thank you very much. Are there questions or comments?
Yeah, I have a question. Dr. Maddie, do we know what people group are less been vaccinated, boosted up yet? Is it more Blacks or Caucasians? What are the people groups? Is there any demographics towards that?
Yeah, so we are, and I'm not sure if Matt is on the call. I hadn't seen him earlier, so I'll start, but I'll allow Matt to weigh in. Matt Haslam has been the champion for the data that you've seen, the incredible slides that you see every time I come to the Board of Health, the data dashboard that is up to date on a daily basis from the City of St. Louis's website has been all thanks to Matt Haslam. And what I appreciate about Matt and his leadership is he's not just a numbers guy. He takes great pride in really interpreting the data and making me and the rest of the DOH look good when we need to report this out. So I just want to thank him publicly for that, because he has consistently provided us with incredible information that, and my good friend, Dr. Corey Bradley, always says data is justice. And without the work of Matt and other EPIs, the Epidemiology Bureau here and across the country, we wouldn't be able to inform policy. So to your question, one of the areas where we're seeing a lot of disparities when it comes to boosters is within the pediatric population and the younger children aged 5 to 11. And I'm concerned that this will persist. We're seeing that. We also see a disparity by race, but I'll let Matt unmute and speak a little bit more to what we may be seeing here.
Yeah, exactly right. And thanks for the flattering words, Dr. Bundy. But yes, to your question, boosters also have a racial disparity. Caucasians far and away are sort of leading the way there with getting their booster doses. And we saw a similar pattern with the primary series of vaccines. Caucasians were a lot more sort of gung-ho to get vaccinated right when they became eligible. And we saw the same pattern with boosters. And so, there was a big spike in vaccinations among the Caucasian population and also with the African-American population, but not quite as high. And then the rate of vaccination among African-Americans actually was higher for a while, but at a low level, right? So it's, we're seeing the same thing with boosters. Caucasians had a big spike right when they boosters were recommended, and then that kind of fell off, and now we're seeing a similar pattern. But there is quite a disparity as well.
Hi, all. This is Colleen. Can I ask a question?
Yeah, sure, Colleen, go ahead. Welcome again.
Thank you. Are we seeing, do we think that so to me, it seems like if a population of folks have gotten vaccinated, there's a different barrier to getting boosted. And do we have any insight into that? Or do we feel as if, for example, their place of employment required vaccination, so they got vaccination, but their place of employment doesn't require booster, so they're not taking that next step?
That's a great question, Colleen. And our data is not quite that granular. But what I will say is that I do believe that misinformation and disinformation, as well as the unfortunate lack of confidence that has been increasing around CDC and maybe the national approach to COVID, and people not always understanding that unfortunately virology is not static, it evolves. And so what may be recommended at one period may not be the same. Variants are different and they impact the community differently. And so I believe that what we are seeing is that it took a lot of effort, a lot of education, and a lot of dialogue to get people to the point where they were willing to just take the primary vaccine. But for people who are in that middle of the road, or even lacked a lot more confidence, it was a bigger push to then say, come back and get your booster. And some of the onus is on us in science and medical, in the medical community and in public health, to really educate folks about why that is, to really look at why this has been so much more challenging with COVID than other vaccines that require, we require flu every year. And while there has been a lack of confidence there, there's a relative acceptance and understanding about why that is. And it's important that we get people to that point here too.
Hello, Dr. Maddie. I have a question. Yes, it's great that 68% of the St. Lucians have been vaccinated, and maybe even more consider natural immunity. So you're saying 4 to 6 weeks, maybe we can reconsider the mask mandate? Is that looking at the timeline, maybe next meeting that we can talk about it, or?
Yeah, I'm glad you said that because I will never put a timeline on it. I think when you do, folks get upset, right? There are other states that have, and other jurisdictions, which is why I'm getting a lot of pressure here to provide a timeline. Timelines are helpful, timelines are reassuring, but again, virology and the state of COVID has proven time and time again that we cannot do that to people, and because it continues to erode trust. In the past, if I wish I did have my slides, I can show you peaks where we went down too fast in our mitigation strategies, and you see it beautifully in how it's diagrammed, where it comes down and then you have another peak right there. And so what I will say is that what we need to do is see our case positivity rates, hospitalizations, and deaths all go down uniformly, that we need to also see them stay uniformly down for a stable period of time. One of the things I am doing and will be very vocal about and will report back at the next meeting, because we have to have this discussion, is a uniformed approach to what metrics are most helpful once you start getting closer to the 5% case positivity rate or lower hospitalizations. And I'm in talks with the county and other public health leaders in the region to see if we can have a standardized approach, because operating in silos and having different metrics is very, very confusing for folks. But I will not prescribe a time to it. I think in general, it's fair to say that if our data continues and stably stays the way it is, we'll definitely be discussing that at our next meeting. The difficulty as well here is Craig Schmidt has, who's always thoughtful about these things in a way I appreciate, has brought it to my attention that there is a piece here that makes this a little bit more challenging, because public health should not be put in a position to where we are constrained to timelines, but there's a legal piece of this where there are rules about when you can renew a mask mandate, how long, if you remove it, how long afterwards you can reinstate it. So what I will be working on between now and March 6th, which is how long our current mask mandate is in effect, is making sure that we're clear on the fact that we're able to reinstate a mask mandate if that's needed in the future, and don't put ourselves in a position not to. But more importantly, that we're clear on the metrics that we're using and that they make sense for where we are now in the pandemic. That marker has always been cases and the case positivity rates, but there are other metrics that we need to be considering here to make more informed decisions. And many of us, myself, Dr. Faisal Khan included, believe that hospitalizations are one of those metrics. So we are all working on that. As you're well aware, these things are changing every day. And so you will continue to get those updates from me as they arise.
Dr. Maddie, just so you know, I pulled up the dashboard while you were talking so people can see the graphs and stuff. So you were narrating a graph.
This is great report, Dr. Maddie. And I'm glad you alluded to the collaboration with Faisal Khan in the county, Dr. Khan in the county. I just want to commend the health department in the city and the county for this collaboration. I think the public needs to be aware that there are ongoing meetings, shared strategies, shared approaches around whether it's a mask mandate or others. And I think that's resulted in more of a holistic approach across the region, more of a consistent approach across the region. And an approach that will result in more trust in the operations of the city and the county health department. So kudos to that level of collaboration. Thank you.
Thank you so much, Dr. Ross. And I want to make it clear so that folks here are aware. I've tried to announce this at previous meetings, but not everyone may have heard this. One of the first things I asked for when I joined the health department in October was, after one of the most gracious and welcoming introductions from Dr. Faisal Khan and his team over the county, I approached him and I said, would you be willing to meet monthly with me, my leadership, your leadership, and our respective boards of and to align wherever possible. He was very gracious in accepting, and we have been doing so since that time. So since October, we have been meeting monthly, and it has really been fantastic in that we are very clear. One of the first things I did was there were 2 different isolation and quarantine periods for the city and the county when I came. We were able to standardize those within a month of me being here. We had no test to stay, test to return when I first came. The county did, and school leaders were very clear to me that made it very difficult operate from both areas within the same school. So we were able to standardize that within 6 weeks of my start. Where we are challenged, though, is that we do operate under different legislative and enforcement bodies. And while we operate by a charter system and a board of aldermen, they do not. They have a council. And so while we may agree on paper on how we may want to approach things like a metrics for mask mandate, that may not happen in real time because of those realities. I agree with Dr. Ross, and I welcome that feedback.
I think you're on mute, Dr. Maddie.
Sorry, we need to have patience. We need to be, I was saying that I was thanking Dr. Ross for that feedback, because while I know, and a lot of you here know, that we are having those monthly meetings and that there has been policies that have been able to be aligned, the public needs to know that A, we are meeting, but B, there are limits to what we can do based on the difference in how we run, council versus a charter system with a board of aldermen process. So, I definitely think, speaking with both of our PIOs and communications team, to do something within the next week or so to let the public be aware of what we're doing and the realities of what that means and doesn't mean may be helpful. Does that sound like what you may be suggesting, Dr. Ross?
That's precisely what I would love to see. Thank you.
Yeah, and let me agree with Dr. Ross that I've been part of those meetings too, and I think they've been very fruitful, and it's great that this was set up. And we're not exactly sure what'll come of it, as you've indicated, but it's certainly a step in the right direction. Other comments or questions?
Dr. Mahdi, are you going to continue, you and your team going to have the resources and ability to continue trying to vaccinate more people in the city, especially the hard to reach populations? Or as the numbers go down, is that not going to be as much of a priority? I know you've done a tremendous job so far, and it may be diminishing returns, but obviously the disparities are really important to address.
Yeah, I think that is going to continue to be a priority for us. It always has been, and that hasn't changed. But we are unclear about what is going to happen by way of vaccine availability from the state as things continue. We have had recently some orders not able to be fulfilled. So we will continue to work with the states who, the DHSS has been really phenomenal and supportive during my time here in reaching out, supporting us, trying to provide us with what we need when we can. And so I'm confident that anytime they're not able to, that is not from any sort of barrier on their part outside of what's unfortunately happening throughout this pandemic. So the vaccinations continue to be a priority for us, the most important tool in the toolbox, and boosters being the highest priority there. But it will continue to be a multi-layered approach. And just because the numbers have come down, we don't scale back. If anything, we hold steady, we stay the course, we continue to push so that the numbers get even lower to the 5% target as defined by the WHO and stably stay there. The way that we acted in the city of St. Louis had a direct impact on hospitalizations and how overwhelmed the hospital surges were. You know, the partnership with Nomi Health that I introduced significantly reduced traffic to the hospitals. They gave us feedback about how helpful that was. The DOH team working tirelessly to uphold vaccines has gotten us to that 61% within the city. We still need to go higher. So that has to continue so that we can really charge towards our new normal.
Great, thank you very much.
Excellent. One quick question I would have, you mentioned several times the need to emphasize boosters, and is there change in messaging going on, or do you think that do you have any sort of change in your social media strategy around that?
Our social media team has increased engagement by over 200% in most platforms since since over the last 3 months. We have seen the fact that folks are coming to us waiting for Kim and Harold, who now routinely will let people know on Monday or Tuesday where they can go for testing, Wednesday or Thursday where they can go for vaccine events. They are sharing. We've had in excess of 1,000 shares on different social media platforms. So we know that the public is engaged in that way. But the reality is, again, people are tired, right? People are tired of having to be asked to do one more thing and one more thing and one more thing, because now it's beginning to feel like that one more thing may not actually be getting them to the promised land, right? So for us, that means continuing to be transparent. I make myself available for webinars, town halls. I recently was at a senior living facilities talking to them and their testimonies, what they've been through, their fears, what they've survived were incredibly overwhelming and touching to me, but also made it clear that we have to continue. I welcome any feedback about, how we may need to do that. But what Harold and Kim and now Jasmine, our new team member from the CDC, who are so thankful has joined our communications team, do is we meet every Monday and we talk about what are the critical messages. So, we knew in response to the fentanyl overdoses last week that would be messaging this week. So you'll be seeing more about that. We know when the messaging around pregnant women came out, we partnered with Planned Parenthood and did a campaign on social media that was very well received around pregnant women. We have been doing messaging around the disparity in young children. And so we will continue to target messaging where the need arises. And I agree with you, Dr. McBride, that boosters must be that for the next couple of weeks as well.
Excellent response, and kudos to your social media team and your whole team and all that.
And Dr. Marty, could I just share a couple of things too about the messaging? Over the last couple of months, you'll notice that our messages to encourage vaccinations also will have a tagline and boosters. So that's something that you should have been seeing. And a couple of weeks ago, we also changed our gift card program to include gift cards for people that are getting boosters. So those are a couple of things that address what you're asking about, Dr. McBride.
Excellent, thank you.
That's an excellent point, Harold. Thank you for that.
Any other comments? Questions? Okay, maybe I'll move on to the next agenda item. I thought I would use a few minutes of the meeting to give you an update of where we're at on the Medicaid expansion in the state. I brought this to the attention of this group before. You can see my slides, right? Great. So as you know, our state approved Medicaid expansion in 2020, and we're the 39th state to approve expansion. Here's where we are right now. The state updates the numbers of people on Medicaid in the Medicaid, what's called the adult expansion group. Since that's the group it was expanded to, they update these numbers every week. And so I put them in a graph here. And as you can see, we have 64,210 enrolled in as of last Friday. And the governor's projection for how many people would be enrolled by the end of the year was 274,312. So we're at about 23% of that number. We're obviously behind where we should be we're between the 4th and 5th month of the expansion since we started late in October due to the lawsuit. So we should be probably around 200,000 now, but yet we're at about 64,000 per reports, including in legislative meetings and the oversight committee meeting. There may be 73,000 or more applications pending at the state that they haven't worked through. So that's both encouraging and discouraging in some ways. Obviously, they shouldn't be pending that long, but it is encouraging that maybe 130,000 or so people have tried to enroll in a Medicaid expansion. I did a snapshot of this report from the monthly management report, and this was as of December. The January report has not come out, but one thing you see here is that at that point there were 65,000 applications pending. But the thing that's worrying many of us is how long it's taking to process the applications. A year ago it was 8 days, and now it's 70 days, 70. And it's not supposed to be that long. They're supposed to do it in about a month. And so the increase in the number of days it's taken to process applications, you can see it's gone from 21 to 49 to 65 to 70. So there's been a lot of concern about that and questions raised. In terms of what's going on in St. Louis region, here's the numbers, and these are a little bit behind because we haven't seen the January report yet. So this is the numbers as of the end of the year. And you can see that in St. Louis City, there were 3,817 enrolled, and our center had projected county level enrollment. And we had said that given the 274,000 number, we might expect about 18,263 in the city. So we're at about 21% of that number, which is roughly about where the state is. There's quite a few counties that are below that. St. Louis County has the highest number in the state, 7,342, and about 26% of their projection. So I think I showed this slide last time, things we can do. Awareness. I'm not sure everybody knows that we actually have started expansion. There's some focus groups that suggest that we need to do more outreach. Here's some suggestions of outreach. One's from the Missouri Foundation for Help has created a social media guide. And my friend Sean Joe at this Brown School is working with the Black Men's Health Coalition. That's another example, Home Growth St. Louis. And I'm really excited about that collaboration and helping people to enroll. Questions? It looks like Colleen, you got a question.
Yeah, thanks, Tim. One of the things that we are hearing is that the folks that we are getting enrolled are getting trapped in this like incredibly long backlog to actually process their applications. And so I'm wondering, in addition to all of the work that you said, we need to keep doing, awareness and getting folks registered and all those things, what are the pressure points that we have, or where should we be focusing some energy to help improve the back end of the barriers that we're facing?
Yeah, what you're talking about, that struggle is, people are doing the right thing, as I just said on the slide, awareness, helping people enroll, and then it's going into a queue that's more than, on average, more than 2 months long. We've heard reports, some people are waiting 4 months. And I think there's been pressure put on the agency and questions about why this is happening. And, it's hard to tell exactly why it's happening, but I've even heard the term perfect storm be used in a Rural Health Net Oversight Committee meeting. So you have a combination of our antiquated our computer system. We have turnover at state staff that we've heard about a lot. In low pay, we have one of the lowest paid staff in the country. Governor's trying to rectify that. And then you have people that frankly have COVID and sort of aren't able to show up at work, so they're sick. And then I think there's lack of awareness. So your question is, you know, I don't know if that's encouraging, but I think, you know, reaching out to the state to say that this is concerning, and they'd like to see them do something about it. It's hard to figure out exactly what could be done, but I think there's many others that are pressuring at the same time, Colleen. So I don't know if that helps answer your question.
Thanks, Tim.
Any other questions people have? Obviously, I guess the reason we brought this to your attention is we can get those 28,000 or so enrolled in the City of St. Louis. It should be able to help get them access to healthcare in general. So I'm ever an optimist, a little discouraged right now, but I hope it continues we can get through this backlog. Okay, if there's no other questions, I think we'll turn to committee reports. And the first committee report is the Governance and Nominating Committee. Linda, I think you take that away.
Sure. Thank you very much, Tim. Well, first, Chris, I want to say thanks to Tim for stepping up and filling in for the chair position for the months of February and March. We're grateful to him for filling this void for us. I did consult the YouTube December minutes. We did commence a 60-day nominations period, actually, in December, to receive nominations for a new chair of our board position. So right now, the nominations period has been open. We've received one nomination so far, which is that of Serena Mohammed. I think we'll just extend the period a little bit, take an official vote next board meeting. And in the meantime, our committee will get to work on reaching out to those board members whose terms will be ending at the end of this year, and working on filling any vacancies in the upcoming year. So I think that's all we have right now, Tim. Thank you.
Excellent. So this meeting in part serves as a further notice that the chair position is open, and kudos to Serena for being willing to be nominated, and I think you'd be a great chair. So any questions for Linda? How many vacancies do we have on the board now, Linda?
So we do not have any current vacancies in 2022. We will have additional vacancies in 2023. There are some people who will have, some board members who will have completed their first term in 2022, and we'll need to reach out to them to see if they would like to continue a second term in beginning in 2023. So I don't have a number for you yet on exactly how many vacancies we'll have going forward.
That's fine. Any other questions for the nominating committee? Okay, thank you. Academic
Sure.
Public Health Collaborations Committee, is there a report?
Good morning. So limited, as you may know, one aspect of that effort is with some Missouri Foundation for Health funding. There's an effort to have that extended, and as I've reported in the past, looking at our workforce development efforts. You may remember the name of Janine Arraghi, and she has been part of that effort, but no other further report at this time. Thank you.
Excellent. I hope that can be extended. Are there questions? Go
Yeah,
ahead.
a question, Craig, regarding the engagement of University of Missouri St. Louis. As you had mentioned before about a couple of individuals who either are part of the collaborative or are interested. What's the status of that?
I do not have any additional status. If those names are shareable, obviously, we've talked in the past. You've expressed some interest, Dr. Ross, as has Dr. McBride and others, so that we can work with Dr. Maddie and others here to see how we can move that together. We are blessed, and I have to tell you all that we're blessed with many great institutions of higher learning, and we need to take advantage of that. Yeah,
Thank
I
you.
don't have any additional report though at this time.
Yeah,
Thanks.
let's keep that on the front burner, because I think we have a great relationship with St. Louis University and Washington University, and I'd love to see, UMSL play a continuing role. Sue Kindig was from UMSL, but she's no longer there. So I think it would be great to sort of rekindle that.
Thank you.
So you mentioned workforce, I think that I'll just I don't think it's news to anybody on this call that practically every meeting I go into, there's concerns about the healthcare workforce. And I'm an economist, so I look at the labor numbers, and there are some fairly alarming numbers in that employment numbers. And I would listen to a seminar last night with Paul Krugman and others about what was ostensibly called the Great Resignation, but a lot of us don't really like to call it that because it suggests that people are leaving the workforce voluntarily, because they don't really need a job. And I think really what's going on is people are switching jobs. And actually, there was a consensus that most of this is a good thing because some low wage workers are getting higher wages. But there are pockets of concern, and one of them that I've been highlighting a lot is nursing. We've seen a huge shortage of nurses nationwide, and especially in skilled nursing facilities. There's been a 12% drop in employment in skilled nursing facilities. So I think any work your team can do, Craig, on workforce, or any of us can do on that, is we need all hands on deck on that one. Okay. Health Communication Committee.
Yes, Matt Haslam is going to give us a brief overview of some great slides showing the results of our DOH Communication Priority Survey, public survey that was conducted in the last 4 months.
Yes, thanks, Lisa. So I'm just presenting the results, but all the hard work was done by Lisa and the communications team, Harold and Kim, working with some of our alders. So going to keep it pretty brief and just zip through some demographic info about who filled out the survey. So here are counts by zip code of the responses that we received. On the left-hand side is just the raw counts. So you can see the darker areas more in the south. On the right-hand side, I've adjusted for population size. So these are the response rate per 10,000 residents. And you can see it's a little bit more equitably distributed when you adjust for population size, but certainly the most sort of in this south central area, and then a little bit fewer on the north side. As far as age, we had a pretty good distribution of age of participants who filled out the survey, particularly between the 30 to 69 age range, with about equal spread in between there. And then lower response from the younger adults, 20 to 29, and also a bit fewer from the 70 to 79 age range. And in total, we had 865 responses. Females were more inclined to chime in with their opinions in the survey than males. And that's all I'll say about that. And then by race, Caucasians had an outsized role in participating in the survey. But we did have a decent amount of responses across the board. And then for the meat of the presentation is the results of what we asked about. So there are 3 tiers of questions that were asked. The first being, have you heard about services for each of these 6 priority areas that the Department of Health provides to the community? And so mental and behavioral health and STIs and emergency preparedness were the top 3 that people had heard about. Less so on the scale was gun violence, food safety, and nutrition and active living. And the next tier was, have you seen this service delivered in your community? You can see there was a significant drop off in those who said yes, these dark blue bands. And so actually emergency preparedness was the top there. And in our emergency preparedness program, we administer vaccines. So potentially that's part of the reason why this emerged at the top of why the service has been seen the most frequently of the 6. And then mental and behavioral health, and then gun violence was at the bottom with only 10%. And then the last tier was, have you used the service yourself? And you can see that nutrition and active living, which was among the lowest that people had even heard about, was actually the highest that had been utilized in addition to emergency preparedness and actually food safety. And the bottom of the list was STIs and gun violence, and only 2% had used this service. So the next sort of series of questions we asked, which of these 6 areas are most important to my neighborhood, getting a sense of their community, and then at a more personal level, me and my family. So the neighborhood is the dark blue bands, and then me and my family is the light blue bands, and they show a similar pattern. And topping the list was gun violence, far and away had the most responses as the #1 priority. And keep in mind that we asked people to rank their top 2. So these numbers are higher than the total number of responses, and that's because people chose more than one priority area. So gun violence and mental and behavioral health, which includes substance misuse, were the top 2. And then food safety and STIs were near the bottom. And then just sort of as a sub-analysis, we separated by north and south zip codes. And you can see that the patterns are remarkably similar, with gun violence, mental and behavioral health at the top, emergency preparedness and nutrition, active living in the middle, and then food safety and STIs at the bottom. So there was a pretty consistent sentiments being expressed across the city. And then lastly, we asked about some of our messaging. And so our current DOH phrase, be well, we asked if people had heard about it. So 81% of those who responded said no, they had not heard that phrase. And then 19% said that they had. And for those that had heard the phrase be well, we asked where they heard it. And so topping the list here was Facebook. Kudos to Kim and Harold and the communications team for that. And then on billboards and bus and train shelter, what do they call those? Where you sit for the bus, and then on TV as well. And then lower on the list was Twitter and Instagram, the radio, and Nextdoor. And then lastly, we asked about what the preferred slogan. So if you had your pick of these 5 options, which one do you prefer? So similar to our current phrase, they're all sort of a riff on that. But the most popular phrase was "Be safe, be well, St. Louis." And so you can see that this St. Louis suffix was preferred by most people. And then "be well," so just adding the St. Louis at the end, was preferred over our current one, "be well." So be well, be safe, be well, St. Louis, followed by be well, St. Louis, and then let's be healthy, St. Louis. And this is just the percentages of responses. And just the last slide of how we sort of presented these 6 areas. So really interesting results with gun violence and mental and behavioral health topping the list of most important. So kept that very brief, but happy to take any questions.
Excellent work, Matt, and your team. questions from the board?
Oh, I appreciate that last slide. I'm assuming that folks got a definition of these categories at the beginning and then they went through, but I'm just curious, when we talk about mental plus behavioral health, there was a slide where it sounded like people said they were receiving those services from the health department. Is that accurate? Okay, this is the, okay.
Yeah.
Go to the one before this.
Okay.
Have you seen this service delivered in your community? That's the one that I'm thinking about. What would that look like for the health department? Because I'm wondering if people are saying they're seeing it, what are they seeing?
Yeah, that's a good question. I might let Lisa or the comms team.
I can chime in, Matt. So the question was a little broader than the health department supplying the service. They all were addressing, have you seen this public health issue in your community? So it wasn't just the health department that's providing the service, it was anybody providing the service. I think Matt kind of alluded to that it was the health department that was providing the service, but it was broader than that.
Okay, that's helpful.
Thank you. Misspoke a little bit. I meant to say that these are top priority areas for the DOH, but as Harold said, not necessarily administered by the DOH.
Thank you.
Thanks for that clarification. It's interesting to me that like one example you cited was food safety is not towards the top, gun violence is, but then a lot of people had received food assistance. So that's a nutrition and active living. So that suggests that, I think there's the people that really need it are getting it. All right, so are there strategies to use this to, take some next steps on communication? Or are you still digesting the results?
I'll let Harold talk after a minute, but I had an interesting conversation Dr. Rhonda Ballou about a month ago when we looked at these numbers, because they really hadn't changed in the last month much. And she had the wonderful suggestion that we want to look at the groups, partner with the groups, or get our messages in alignment and support the groups working on the issues.
Uh-oh. Is she frozen?
Yes.
Okay. Sorry, Lisa, you're frozen.
Yeah,
So
I'll chime in, Dr.
Thanks, Harold.
McBride. So as Serena alluded to, the health department doesn't provide some of these services. So we'll probably be looking at, and we haven't decided yet, but we'll more than likely be looking at partnering with the service providers that are providing some of the services and seeing how we can help uplift the messaging that they're doing. So, but we're still working on digesting what we got and working on next steps.
Thank you. The one that Serena pulled out, the mental behavioral health, is clearly an important one. And, I keep hearing it's a rising concern in the pandemic. So I think continued attention on that one.
I also think it's interesting to look at the difference between the issues that people prioritized for themselves and their family versus community, because that speaks to people feeling like it's important to them personally. And the strategy for how you connect with that, I think, would be different than a strategy that's more community focused. So that's very helpful that that is separated out in the way that it is.
Right, and you can see that for the issues that are a bit more personal, like nutrition, active living, and emergency preparedness, that's more important to the individual level, me and my family, than it is to say the neighborhood. And maybe that's as you're saying, just a difference in how people think about it and how can we message around those areas.
Yeah, that's an excellent report. I really kind of changed my outlooks of what are people in cities thinks about the important to them. And I didn't know gun violence is top of the list, and yet we spend a lot of time at the sexually transmitted infection, but yet it's not that important to relative to the gun violence. So I just didn't know if there's anything that health department or maybe the city of St. Louis can do about the concern that it looks like the community is expressing on, say, gun violence?
Anybody want to jump in on that one?
So I would say, I think that's also a messaging opportunity, because the health department over the past year at least has been very active in the gun violence space. But I don't know that everybody makes the connection that the health department is where queer violence is stemming from, or that the health department has these initiatives that were launched in the past couple of years specifically focused on interrupting violence. So I think there's an opportunity to be more clear about the fact that this is a public health issue, and here is the positioning of the public health department in actually addressing this. But to your point, there's still an opportunity to amplify what we're doing and do even more so that folks see that we're being responsive.
Yeah, I think that's a great, oh, go ahead, Paul, sorry.
Yeah, I really agree with Serena, and maybe we can partner up with the police department or maybe the mayor's office and have a better impact on the well, with the health departments involved, be more impact to what we can contribute to this concern that people are expressing.
One other thought I had was I like those messaging opportunities, and be safe, be well. St. Louis kind of jumped off the top, and it strikes me that be safe could be, you know, used to talk about gun violence. So I wonder if there's like a messaging, social media, or the signs that could say at the bottom something about what the Department of Health's doing to cure violence right under that message. Just a thought, but it might be some.
You're frozen, Tim.
Something. Thank you for your clear presentation. Okay, hopefully you can hear me. My thing is saying I have low internet. I'm going to turn it back to Dr. Mandy for departmental updates.
Thank you so much. I will pull these up and then provide them. Please bear with me. Okay, so a few updates. I'm going to go per division and I'll keep them high level. So from an epidemiology standpoint, from our Bureau of Epidemiology, the performance management team is using Turning Point's performance management self-assessment tool to evaluate and improve performance systems. All departments recently update their performance objectives and measures for their monthly performance reports and initiated this data collection. Staff are also increasing communications around quality improvement, and we're using quality improvement tools for brainstorming improvement for issues that have been persistent throughout their time, recent years in the health department. So I'm really proud of the team for taking that initiative and trying to really figure out ways that we can be where we may not be addressing are fully exercising our epidemiological strengths as much as others. As far as the community health assessment in partnership with St. Louis and County, that is going well. I had an initial meeting with them, and we are starting to have some orientation sessions. The first one actually today. We'll be using the a map tool around strategic planning to model and reach the community and our partners with this. So we're excited about this because it moves us forward towards our accreditation goals. From an environmental health services perspective, we're excited to see we're continuing to fill vacancies. We've welcomed over 10 new people in that bureau since I began. So in the most recent weeks, we've welcomed a new secretary and a new pest control worker. Also, we have an internal promotion that has been filled for a vacant program manager position for emergency preparedness. So very excited about the growth there, hoping that it'll continue to help us to build our capacity. Vaccination efforts have continued, offering pediatric vaccine along with first, second, and booster doses. 12 vaccine clinics were held in January with 712 doses given, along with an additional 107 homebound doses provided. Food and Beverage Control Section is implementing an online application form for temporary food licenses to help streamline the process for special event permitting. And staffing levels for animal control and officers remains at a critical level. We still have only 2 fully qualified ACCOs and 2 staff in their working test period. So while we filled those positions, it's important for the public to understand that there's a working test period that they have to fill. That means that our staff still are bearing the brunt of the load because they're not able to do all of the services that are required. We also have 1 per performance employee to cover day-to-day operations. So in response to that, we've recently submitted our budget proposal for next year, and we have significantly expanded our request for positions. This is, the growth is great to see, but there's still a lot that has to be done around training and getting people in. So the staff are still feeling it, unfortunately, to much of the same degree. But once people are out of their testing period, we'll have doubled the staffing in that department. From a fiscal standpoint, the FY23 budget for the Department of Health was completed and submitted on Friday, February 11th. The fiscal staff are currently working 2 days in person and 3 days remotely. Currently, there are 2 open positions in the Fiscal Bureau, and I got a notification today that we've been able to fill one of those. So that's very exciting there too. So we're continuing to see growth there. From a women, children, and adolescent health perspective, the Fast Track Cities initiative that the city has supported since its initiation in 2019. I want to make sure I got that year right. I think it's end of 2018, but I may be wrong. Had the first meeting of the year they set up macro and micro committees to discuss rules of engagement, planning activity, and short-term goals. As you may remember me letting you know previously, they had a recent change in leadership. So this is critical to how they move forward this year. Women, children, and adolescent health have completed 731 immunization audits. 2 child fatality cases received follow-up. The Wise Woman Transit ad has been approved. We've been waiting on this, so this is exciting. We hope to see that up soon. Nurse Angie in school, our in-school health nurse, is working on updating a summary of compliance report to share with the EPI team. And our Men's Health series on stress management was recorded on the 25th of January, and it's undergoing final edits. This will be a great initiative to be able to provide much needed support and education around stress in this demographic. As far as HIV prevention, for our Ending the HIV Epidemic initiatives, Tyrell, who's been taking a great leadership role there, is providing PrEP training to the Texas AIDS Education Foundation. National Black HIV AIDS Awareness Day is February 7th. There's a regional mailer to 7,500 homes across the city of St. Louis region. Will receive this mailer to begin and prompt the conversation of National Black HIV and AIDS Awareness Day in St. Louis. That's a huge, huge distribution list, and I'm really proud of the team for engaging in that initiative. The community can then engage in 5 different ways. They can order a take-home HIV test, find a testing center near them, download the Village app STL for more support services, and also register for the regional town hall on February 24th. Lastly, they can share their testing experience online. Just want to commend the team for this work. This is innovative. This is community engagement in ways that we've never seen. And I just want to thank our partners and Brenda for her leadership in moving this forward. We have online peer ambassadors. So peer ambassadors will also amplify National Black HIV/AIDS Awareness Day on February 7th. They'll share their experiences, reach out directly to their peer, and in an authentic way, engage in their network on the importance of this day. Lastly, they're going to do a business blitz to about 20 or 30 businesses with selected areas to share and engage with the constituents wherever necessary. I've just never seen this level of engagement, of innovation. And I just want to thank, again, the team for that. Our TB and refugee help, you may have seen our social media campaign as part of an employee spotlight to really highlight the incredible work and show how much we value our staff. And Tammy, who has been taking the lead here, is to be commended. Please check out that employee spotlight. So there have been 75 medical screenings provided to refugees in the month of January, an incredible feat given the fact that Tammy has been really upholding this effort individually and now has some volunteer support from another member of our staff. So lastly, from the grant administration section, federal grants is in receipt of the FY22 partial award of over $2 million, which is an estimated 30% of the FY22 award. The Planning Council has approved the budget and we're in the phase of issuing contract agreements to our sub-recipients. We also have a site visit scheduled with HRSA on March 7th through the 11th. So I will pause there and take any questions or comments.
Have we lost Tim? Tim McBride?
I don't see him on the panelist list in the meeting anymore.
Oh, okay, so he dropped off. Well, okay, well, Dr. Maddie, thanks for that overview of the department. Everyone's working quite hard, and I think we should all remind ourselves that COVID is not the only public health issue on the table, right? So we have a sense of equipoise on what needs to be done to keep the community healthy, and it's broader than the pandemic. So with that, then, are there any other business items? Hearing none, there's no new business. Any old business? Hearing none. Okay, well, sounds like we've concluded the next, I see from Kim, thank you. The next meeting is March 17th at 8 a.m. Dr. Maddie, sounds like we still, based on your presentation, we're still looking at a virtual meeting, at least for the next, well, as you said, no time frame, right? We're still looking at a virtual meeting until the virus tells us otherwise. And so we will be planning on meeting and virtually in March. I think Tim just emailed saying that he lost his internet. So, well, that happens. Okay, I think this has been productive. I think we have some great direction, and we need to talk about, as Dr. Maddie, at the next meeting, whether Tim is in charge or whether we have a new board chair, Serena. I would like for us to talk a little bit more about the collaboration. I'd like to hear a little bit more about the collaboration with the county. Of course, would you talk about the governance structures and how that differs? And then again, just to reiterate a desire to have the public understand what we're doing together and some of the limitations on what we can do, so they can understand that governance distinction. So love to have that, get a little bit more discussion at the next meeting.
Absolutely.
Thank you, Dr. Maddie. And with that being said, I think I'll entertain a motion for adjournment. Is there a motion?
So moved.
Is there a second? I guess I has a motion and a second. All in favor of adjournment, say aye.
Aye.
Aye. Okay, well, we'll see y'all the next month. Thanks.
Thank you.